Hey guys, today we're going to talk about cervical isometric contractions. Okay, basically what it means is we're trying to move the neck, but we're not moving the neck, we're just firing those muscles because we're firing into our hand and we're not letting that motion actually happen. But it still fires those muscles, it still has a lot of therapeutic benefit. Actually, these are the muscles that I would tell patients that are in extreme pain to start out with, because we don't actually have to move the spine too much, but we're still training those muscles, we're still helping alleviate the pain. Alright, so the first one that we're going to do is cervical flexion, isometrically, and what that would normally look like is something like this. Okay, we're looking down, that's flexion. Alright, but to prevent that motion but still get the benefit of that motion, we use our hand to stop ourselves. So we fire down into our hand. Okay, and we just fire for about a second or two, and then we stop, and we do it again, stop, again, stop, again. Alright, probably do that about 10-15 times, about 3 sets. Okay. Early on, you want to be really careful. If it's too painful, do a little bit less, but still fire into that, work on that, and it'll slowly help your recovery speed up. So that's flexion. Next, I would say start with lateral bending. So normally that looks like this. We're bringing our ear to our shoulder, kind of both sides kind of thing, but we're going to stop that motion. We're going to go into our hand. Okay. Same idea on this side. Okay, that's isometric lateral bending. Next would be rotation. Would look like this normally. Again, both sides, but we're going to stop ourselves from doing that. We're just going to fire into our hand. And if you can go a little bit further, then start firing at that point. So if you can only get this far without any pain, start at this point and then fire. That way you're not going into that painful range of motion, but you're still right there at the cusp of what you already have and you're trying to get more. Okay, same thing on this side. If we can go this far, we fire into it that way. So that's isometric rotation. The last would be cervical extension. Okay, normally that looks like this, but again, we're going to prevent that from happening, but we're still going to fire into it. Now you can also do that with cervical retraction or chin tucks. All right, if it's too painful to do a normal chin tuck, which is this motion right here, you're just going to prevent that. Very similar to cervical extension. It's all about what muscles are you firing though. So I would practice doing cervical extension, practice doing cervical retraction, and just kind of realize which muscles are firing, and then do that against your hands. Okay, so those are the isometric contractions for the cervical spine.